Moving on now, rampant drug abuse has thrown Punjab into a healthcare crisis. Hepatitis C and HIV infections are widespread. In the fourth part of our special series, What's Ailing Rural India, Archana Shukla reports that the state's healthcare machinery is simply not equipped to deal with the challenge.
स्वास्थ्य के लिए कुछ विभाग वगैरह है, कोई डॉक्टर है या नहीं है? कोई नहीं है। तो आप लोगों को कुछ तकलीफ होती है तो आप लोग कहाँ जाते हैं?
श्री मुक्तसर साहिब जी 16-17 किलोमीटर पड़ता है।
No public health facility in 15 kilometers radius of this village, Landi Rode, in district Muktsar Sahib. This, however, is a village that bears the highest burden of killer disease hepatitis C in the state of Punjab.
कोई भी ऐसा कोई मरीज हो जाए, ते कोई माल सीरियस हो जाए, या कोई एम्बुलेंस दा या वगैरह कोई भी उदा है नहीं।
सरकारी तो कोई है नहीं, प्राइवेट का कोई?
प्राइवेट है एक दो, वो टाइम पर नहीं मिलते।
तो चूड़ा छाप डॉक्टर है, जिसके पास कोई डिग्री वगैरह नहीं है।
There is just one medical practitioner for 5 to 6 villages. We visited his clinic nearly 6 kilometers from Landi Rode. Villagers claim the local doctor with no medical qualification is much to be blamed for wrong injection practices spreading killer diseases in this region.
आपको ये पता है आप ये बेच नहीं सकते हैं?
सर बेच तो फिर हम नहीं सकते, फिर की करिए जो हम जो बैठे हैं उसका कुछ देंगे पेशेंट तो फिर ही सर
नहीं, पर आपके पास जो डिग्री है या जो भी है वो आयुर्वेदिक दवा और यूनानी दवा की है।
यूनानी भी उन्होंने प्रोडक्ट लिखा है ना, भी थोड़े बहुत तो प्रोडक्ट असी दे ही सकते सर, भी ज़्यादा नहीं दे सकते।
With a certificate from Ayurvedic and Unani State Council, this local doctor was prescribing and selling all kinds of antibiotics and allopathic injectable drugs. The surroundings of his clinic narrated another dismal story. No disposal of medical waste, used and dirty syringes lying around, and no protocols followed in a state that is desperately battling drug abuse. Visit to some of the primary and community health centers in district Muktsar Sahib and Amritsar revealed the other shortcoming of public health system. Large infrastructures primarily unused owing to huge vacancies and absenteeism of medical staff. Even the tertiary care civil hospitals in cities are reeling under staff vacancies, impacting their performance.
So you have a shortage of nurses and technicians?
Mostly nurses.
Punjab government allocated 3,295 crore rupees under medical and public health in its 2016-17 budget. But is that enough?
Now the worst part is in the health system we have not been able to get more funds. Now the only funds that come, they are from the central government. So the state contribution is so less. Now what comes from the center is in the terms of construction, money and equipment. What about the maintenance? What about the staff? How can you run the system without staff? Now we have...
It is these inefficiencies that has promoted private healthcare facilities mushrooming across the state. Nearly 2/3 of hospitalization and over 80% of non-hospitalization cases in Punjab now go to private healthcare providers. Though a big dent on healthcare costs, these private centers do not even follow a regulatory protocol. State of Punjab has not introduced the Clinical Establishment Act 2010 that regulates all private and public clinical establishments so as to prescribe minimum standards of service.
The BMS doctors have opened up clinics in their own houses and the surgeries are done in the bedrooms. So where is the check? We can't go and check. You can't go and...
Because you don't have the authority now because the act is not implemented.
Yes, so unless you have the act in position, you can't channelize the whole system.
The focus of the Punjab government has largely remained on building health infrastructure in the form of buildings and machinery, but has failed to establish a strong health management system in order to promote medical staff's loyalty in public health facilities. With cameraman Bharat Kori and Sunny Paswan, this is Archana Shukla in district Muktsar Sahib.